You finish a quick jog, your wrist buzzes, and a tiny screen tells you exactly how fast your heart is beating. It feels like a moment that belongs only to you and your own biological data. But later that same day, you might see a news report about global border closures due to a new virus, or a debate over the price of a life-saving prescription. It raises a quiet question. When it comes to our physical biology, who or what is actually in control? We tend to think of health as a private conversation between a patient and a doctor. Zoom out, and we find a massive historical system of power that governs almost everything our bodies do. To understand how this works, it helps to think of political power like a camera lens. By adjusting the focus, we can see exactly how control is applied to us at different scales. If we zoom all the way in to a single person, we see anatomopolitics. This is the power of the magnifying glass. It's the physical rules applied to an individual body, like a doctor's examination, a hospital stay, or the ways we are monitored as patients. Now twist the lens and zoom all the way out. This wide-angle view shows us biopolitics. We are no longer looking at one patient, we are looking at population-level power. This is the government tracking birth rates, managing city hygiene, or analyzing the health of an entire nation. Neither view tells the whole story on its own. To grasp how our physical lives are directed, we have to look through both the micro and macro lenses at the exact same time. The person who first gave a name to this dual lens system was a French philosopher named Michel Foucault, writing in the mid-1970s. Foucault identified a major historical shift. For centuries, a state showed its power primarily by threatening death. Think of kings and executions. But in the modern era, that power changed direction. The state began to manage life. This 1860 document shows how that looked in practice. It's a compulsory vaccination certificate. During the 19th century hygiene movements, governments realized that a disease-free population was a more productive and controllable population. This priority created the foundations of our modern health systems, establishing hospitals where patients are constantly watched and their data is meticulously recorded. By the 20th century, the state had traded the threat of military force for the quieter, constant management of human biology. Since Foucault's time, society has grown vastly more complicated. Researchers have identified at least 92 different ways politics intersects with our lives today. To find the forces affecting our bodies, researchers use a critical filter. This filter blocks general issues, only allowing concepts to pass if they have a direct tie to bodily health or the medical industry. Applying this logic isolates a concentrated core of 18 specific health power dynamics that govern us right now. One of the most powerful forces on that filtered list is pharmaceutical politics. This dynamic determines your daily access to medicine. It's the web of industry influence and patent laws turning human healing into a global commodity. Then there is omic politics. This is the 21st century struggle over the data hidden in your DNA. Processing this genetic data requires massive digital infrastructure. Omic politics decides who owns your biological blueprint and how that information is used in precision medicine. Finally, we see necropolitics. Identified by scholar Achille Mbembe, this is the power to decide who is exposed to mortality and who receives priority care during a national crisis. These concepts prove our bodies are constantly navigating intersecting systems of corporate and state power. These academic theories moved out of the classroom and into our daily lives during the COVID-19 pandemic. During this time, governments used biopolitics to enact sweeping lockdowns, close international borders, and strictly enforce public quarantine rules. Inside hospitals, we saw necropolitics in action, as staff had to decide which critical patients would receive a limited supply of ventilators. Meanwhile, global pharmaceutical politics controlled which nations received vaccines first and which demographics were left waiting. A global pandemic acts as a diagnostic tool for society, forcing these underlying political systems into the open, where we can finally see them at work. Realizing that medicine and health are heavily politicized is an empowering realization. By naming these forces, we give ourselves the vocabulary needed to demand fairer health systems and better care. The next time you read a medical news headline or visit a clinic, you can apply this critical filter for yourself. Recognizing the politics governing your body is the first step toward reclaiming your autonomy over it.